I'm Raj Vuppalanchi. I'm a hepatologist at Indiana University Medical Center. I'm excited to be at this meeting and presenting some data on behalf of my collaborators and co-investigators. This particular study today that I wanted to talk about was the drug-induced liver injury from hormonal contraceptive agents. As you know, many know that hormonal contraception was initially introduced in the 1960s, primarily for contraceptive benefits, and subsequently expanded to non-contraceptive benefits such as dysfunctional uterine bleeding and postmenopausal care. The initial formulations had a higher dose of estrogen, and soon after it was recognized that they were causing liver injury, and then subsequently the formulations had decreased the dose of estrogen. Currently, hormonal contraception can be either progesterone or in combination with estrogen and progesterone, can be given orally, can be given as a subdermal implant, or can be given as a patch. So our question primarily was, in the current era with the current generation of hormonal contraception, what is the risk of drug-induced liver injury? So that was the premise for us asking the question into the DILIN database. For those who may not be familiar with the drug-induced liver injury network, we call it as DILIN. This has been a network of 8 sites over the last 20 years, funded by NIDDK, where we prospectively enroll patients with suspected idiosyncratic drug-induced liver injury. And we exclude competing etiology, and we assign a causality score and adjudicate the cases. So when we queried this database, we found 34 cases of suspected idiosyncratic hormonal contraceptive DILI, and of these 34 cases, we found 20 cases that were primarily given for hormonal contraception, and these were high causality cases where nothing else was the competing etiology. So when we looked at these 20 women with hormonal contraceptive-associated DILI, we found that these women are young, in average age of 22 years, with injury occurring as early as 4 weeks, and most injury occurring in the first 3 months. These presented with jaundice and itching, and 50% of them required hospitalization, 50% of them required liver biopsy. Luckily, nobody needed a liver transplantation or had death. So we then looked at age and BMI matched women compared to these 20 women, and sought out differences between, prescription drug-induced liver injury versus hormonal contraceptive liver injury. And we found that the systemic symptoms such as fever were much less common. There were enzymes lower compared to the other group, but otherwise their autoimmune markers were negative. So in summary, we want to emphasize that it can still occur. It is rare but not uncommon, and if you encounter a young woman with new onset jaundice and there's not much competing etiology, please think about the possibility of hormonal contraception as the implicated agent, particularly when the patient may not report a subdermal implant or a patch, and may or may not be documented in the electronic health record. In the full manuscript, we are going to report some atypical presentations, such as liver injury after a topical hormonal patch, liver injury occurring after a subdermal implant, liver injury occurring in a woman who received intravenous estrogen for dysfunctional uterine bleeding, followed by oral contraception. And interestingly, 2 of the women reported itching and cholestasis during pregnancy, and had this liver injury when they were switched on to the oral contraception for the first time after the first delivery. So something to think about. It's rare but not uncommon, and it's a distinct phenotype. So our research is to emphasize that yes, it is still possible, even though with low estrogen combinations at this time, and sometimes it can be also seen with only progesterone as the hormonal contraception. So thank you very much for your interest in our study.